Wow, what a terrific panel. I wanted to talk about one of the systems that was not discussed, and that is juvenile justice. And I'd just like to make mention of a program that was run in Florida by a company, a for-profit company called Evidence-Based Associates, which is very much focused on implementation science. And the company provides the organizational interventions to agencies to which the juvenile justice system may redirect youth who have already been recommended for residential placements. So all of these youth were recommended for residential placements. At that point, in a non-random fashion, some were placed in residential care, which meant in the juvenile justice system in Florida, typically 9 to 18 months in a low, moderate, or high security facility. And Florida Redirection Program deployed 3 interventions: multisystemic family therapy, functional family therapy, and brief strategic family therapy. And those that was considered the Florida Redirection Program. And what I want to show you is that there were significant improvements, or the redirection programs did significantly better in recidivism, which means rearrest or placement outcomes, having to place the child in a more restricted setting than the residential program. So in some cases, the results don't look clinically that remarkable, but in general, in all of the variables assessed, rearrest rate, felony rearrest rate, recidivism rate, felony adjudication conviction rate, and commitment to adult probation or prison, this set of interventions of family-based programs had better outcomes than placing kids in residential. The outcomes were measured in the fiscal year after the treatment was completed. So often the family interventions were completed in 4 to 6 months, 2 to 6 months, I should say, and so the next calendar year would have been taken. With residential, the residential may have completed in 9 to 18 months, and so it was the next calendar year after the kids were released. Each kid was released that was used to look at the rearrest and reconviction rates. And in this case, well, let me save that and give you the exciting news first, which is savings. So what were the savings? So there was a propensity matching study where a subset of the redirection cases was matched with a subset of the residential cases so that we could have sort of a match control sample. And we have the cost of residential by fiscal year that the program was active, and residential usually is in the $34,000 to $40,000 per year cost. The redirection cost was in the $7,000 to $12,000 per year cost. And the differences in the cost per child was in the $27,000 to $31,000 per year. And the total savings to the state, just in this small sample, because actually redirections there were about 1,100 cases that were able to be matched to residential cases in the propensity analysis. So actually, redirections saw about 8,000 cases in this period of time. But with about 1,100 cases, the savings to the system was $124 million. So we think that this is a very powerful argument that we should be thinking about at the state, county, and city levels, where a lot of these services in the juvenile justice system are provided, that family-based interventions have somewhat better outcomes, but save tremendous amount of funds to the state for those children who have been already determined need residential care. So how does the training happen? What kind of workforce gets developed? So the juvenile justice system has contracts with a number of agencies in the state of Florida to provide enhanced care for a number of children in probation. And in those agencies, a cadre of therapists was selected that may have had a mental health counseling background or a social work background. Very few had a family therapy background, maybe none of them. Mostly bachelor's and master's level individuals. And so these individuals, there was an organizational intervention where the leadership of the organization was brought into the redirections program, the family focused intervention. The leadership of the program was made responsible for the fidelity of the program. So when there was a problem of fidelity, it was brought to the leadership of the program, and it was the leadership of the program that then administratively dealt with their therapists, because the supervisors from the model managers from the family therapy programs don't have administrative authority. They can provide coaching, monitoring, supervision, and coaching. But beyond that, where a therapist is not willing to adhere or is unable to adhere, then administrative steps have to be taken. So I think this is a great model, and a message here is that we should be looking at city, counties, and states as places for interventions, because in the current environment, it's going to be very difficult to be able to affect these programs from the federal level.